Do you know the difference between in-network and out-of-network treatment for your health insurance policy? In-network treatment is what you're going to receive 95% of the time when it comes to medical procedures. The thing to keep in mind about in-network treatment is it's there for a reason. There's an incentive for you to receive in-network treatment from your insurance company's list of approved providers. Now, that doesn't mean that you are only limited to a certain amount of doctors that you can see. There is the option to see whoever you do choose. However, the incentive to receive treatment from doctors who participate in a particular insurance company's network, they're going to provide you with that treatment at a significantly discounted rate. So it's going to be in your best interest to seek out those providers and know where they are and to maximize your health insurance by going to those in-network providers. When you receive treatment from an out-of-network provider, they do not participate directly in your insurance company's network, and they can charge you a far greater amount for services than if you were to receive treatment in-network. It's always going to be in your best interest to, when possible, find treatment from an in-network facility. Well, you're saying to yourself, well, what happens if I'm out of town or something happens, an emergency comes up and I'm taken to a hospital and I have no control over it? Good news is, most of the time with insurance companies, they're going to cover those emergency services as if they are in-network, regardless of where you end up. Now, the thing to keep in mind, and this could potentially save you thousands of dollars and a ton of time wasted on the phone, is if you do run into that emergency scenario, you land in the hospital for something, you're out of town, and you're at a location that you're not aware of, you're not sure if your insurance company is accepted or is part of that network. So what you're going to want to do is, after the dust settles and you've had time to come to and recuperate a little bit, you're going to want to make sure either you or somebody that's there with you, a family member, possibly addresses the question of if your insurance is covered in network. If it is, fine, great. Kick back, relax, and enjoy recovery. Otherwise, if it's not, then you might want to consider being transferred out to a facility that is. I know this probably could rub people the wrong way. Unfortunately, that's going to be something that you're going to want to heavily consider due to the fact that the amount of money that you would potentially be out if you did not make that switch. You're saying to yourself, well, why can't I just go wherever, whenever, and receive treatment from whoever I want and pay the same amount of money? Unfortunately, networks are set up for a specific reason. The reason the networks exist is that the insurance company drives patients to those hospitals, those doctors, those facilities, and in return, those doctors, those hospitals will provide treatment at a far greater discounted rate than if you were to just walk in off the street. So it's a kind of you scratch my back, I scratch yours situation. Whether you agree with it or not, that's the way the system is set up, and you're going to want to try and maximize it to the best of your abilities. So next time you do find yourself or know of somebody that is in an emergency situation, pass along that little bit of information to them and let them know that that's something to keep an eye out on. Chances are for your routine stuff, your annual physical examination or just a routine sinus infection visit to the doctor, you're going to be able to know whether or not that provider is in network. So keep in mind the difference between in-network and out-of-network facilities is pretty important, and you're going to want to make sure to manage that the best that you can. Of course, there is a blog post linked in the description of this video, so feel free to head on over to jingolainsurance.com, read up on that a little bit further, and of course, if you have any questions of your own, feel free to let me know. Email me, joey@jingolainsurance.com. Be happy to address any of your insurance-related questions in an upcoming video. But again, I'm Joey Jingola with Jingola Insurance Agency. Take it easy, everyone.